Welcome to Logical Ayurveda. Today we are going to deal about medicine called Chyawanprash and explain its benefits in detail. So we take so much pleasure in explaining Chyawanprash because it is so much near to heart. It is of course without the doubt that it is the most prescribed rasayana in the history of Ayurveda. So as you all know, the main ingredient of Chyawanprasha is 500 amalakis. As you all know, amalaki is param rasayana, vayastapaka, it is having amlarasa and madhura vipaka. It is pitta hara in nature. So it also contains balli dravyas like bala and most of the dravyas of jivantyadi. And interestingly, tikta pachana and rasayana dravyas like vasa, guluchi, punarnava and musta. It also contains vata and lomana dravyas like haritaki and pipali etc. And the very important thing is it contains pranavaha shroto balya dravyas like pushkaramula, dashamula, tugakshiri etc. So its main action is on pranavaha shrotas. In the practice, we find Chyawanprasha as kinchit ushna, snigdha, balya and brahmana. So we do not want to explain Chyawanprasha to you on the basis of rasa panchakas. So that will be a crime. We only want to explain to you Chyawanprasha with the case studies that we have in hand. Because it is so much beautiful and we do not want to destroy it by merely telling you academically. We'll tell you from the practice perspective. So case number 1, a patient of old age who is a renowned lecturer in a government college has came to us for rasayana. He wanted to take some medicine which is balya in nature because he believed in Ayurveda so much. So I advised him daily to take Chyawanprasha in empty stomach, and when he gets hunger then he can have breakfast. So he had done that for almost 6 months. And the interesting thing is he only took it for strength and balya property and rasayana property. The interesting thing was the professor was bald and he developed new hairs in his bald region. And the chest hairs started growing black because his chest hairs were white earlier and his chest hair started growing black, and we can appreciate the half black hair of the chest that is at the base and the half white hair that is at the tip. Such is the param rasayana guna of amalaki. So case number 2, the child was not gaining weight, and if you look at the child was not having proper muscles at all. It was a malnutrition child, and when they brought that child almost 2 years old, the hands were very lean and there was barely any muscle at all. It was as if the skin is attached to the bones merely. So I prescribed Chyawanprasha for 3 months. Because the Agni was very less, I prescribed very less quantity in a prasha quantity in muhu dosage. So after 3 months, they brought the child, and I was very surprising to see it was much better than the effect of any protein powder in any person, because the child was looking very plumpy and it was beautiful. I could not even recognize the child. Such was the Brahmana action of the Chyawanprasha. So case number 3, an HIV patient having end stage complications like HIV patients of MDR PTB and HIV patient having liver complaints, and because he took so much antiviral drugs, and he came to me. This happened before 8 years, and this HIV patient was very close to me, and this HIV patient wanted to live so badly. He had a family, so he was almost on the verge of death because the practitioners told so. Almost every practitioner that he went to refused to treat him, telling him to go and get admitted under some anti-HIV facility. But I took the risk of treating all his complications, and I gave Chyawanprasha at the end. I told, it is having param rasayana property, you won't die, take this medicine daily and you will definitely survive. The patient is healthy since 8 years. Remember, he was having end stage complications. I do not want to go that in detail but he had MTR PTP, he had liver impairment, he had all that. He is living very healthily and he is doing his regular job with help of Chyawanprash, and he cannot thank very less for Chyawanprash. He was the one who inspired me to learn more about Chyawanprash. So the case number 4, patient of congestive cardiac failure came to us. Now the congestive cardiac failure is treated as a shofa Karshana is the main line of treatment because the dravya should be Mutrala. The plan is to have the plan is to give very little effort to heart by reducing the amount of shofa that is present in the body. It's to reduce the workload of the heart by removing the excess amount of water in the body. So the Karshana is the principle of the treatment. Patient was already on Lasix and digoxin therapy, but he was under chronic fatigue because the diuretics were making him weak, where the diuretics were making him lose weight, and he also had other complaints like body pain as well. So there is an altered form of Chyawanprasha. There is a Kashaya form of Chyawanprasha that is available in the Sitaram company. So that is called Chyawanprash Quat, CH Quat. So we gave that Kashaya to the patient for 2 months, and his tiredness relieved drastically, and he is healthy ever since. The Rasayana therapy and Vatahara action of Chyawanprashas. Let's take the example of all the Urdhvajatrugata Kafaja Vyadis like Kafaja Shirashula, Kafaja Pratishaya, Kafaja Kasa and Shwasa. The initial part of the treatment aims at removing the kapha out of the body. For example, a patient of Kafaja Shirashula like sinusitis, chronic sinusitis comes to you, or the patient of Kafaja Shwasa, repeated asthma patients, status asthmaticus patients comes to you. The first aim of the treatment is to remove the kapha out of the body. And how do we do that? We prescribe drugs like Dashamula Kattatrayam Kashayam, Kanakasavam, Gorochunadi Guliga and Agastya Rasayanam to the patient to remove the initial kapha that is present inside the body. What happens after the kapha is removed by all these dravyas? The Vushna and Ruksha Vriddhi happens in the body. The Ruksha Vriddhi turns the Kafaja Kasa into Vataja Kasa. For a patient having chronic cough with the phlegm expectoration comes to you after 5 days and tells that now the phlegm is removed, but now I have dry cough. Such is the condition where you should exclusively prescribe Chyawanprasha. Initial kaphavarna is removed, Rukshaguna Vriddhi is more in the body. Such is the time where Chyawanprasha should be exactly substituted to the patient. You cannot continue the same Ruksha treatment again and again to the same patient, because the Ushna and Ruksha are opposite gunas to that of the Ojas. Kapha is Ojas, so the Ushna Guna Vriddhi and Ruksha Guna Vriddhi is opposite to that of Ojas. What happens when you give chronic Ushna and Ruksha? Dhatu Kshaya happens. The Roga Pratiroga Shakti decreases. The immunity of the patient decreases. So the weight of the patient decreases, the immunity of the patient decreases. So mainly the ability to encounter diseases and the swasthyata in the patient is reduced to a certain extent. So such is the condition where you should not end the treatment abruptly or continue on going to continue with the same treatment, but rather substitute the treatment with the Chyawanprasha. Let me give an example. Let me take an example of Kafaja Shwasa asthma patients. What happens in asthma patients? Once they come, they have chronic phlegm expectorations. So we prescribe all the sorts of Vyagradia, Dashmula Kattatrayam, Kashayam, Agastya Rasayanam, and then we remove the kapha out of the body. Now they won't get asthma only one single time and get cured. Whenever there is a variation in the diet, whenever they take the diet which is cold in nature or oily in nature, whenever there is a climatic change, whenever there is a cold climate like in December or in rainy season, their asthma gets again increased. So every time we prescribe something to remove kapha, we increase the Ruksha Guna in the patients. So to make sure the Vyadi does not come back at the end of the treatment, Chyawanprasha should be prescribed. To simply put, it is the Chyawanprasha has only the ability to make the Roga not come back and to improve the Roga Pratiroga Shakti of the patient. Because we don't work on the principle that a patient cured is patient lost. See, you might have seen that the various people who go to allopathic treatment, they get a cough, they go to immediately allopathy treatment, they prescribe antibiotics and they prescribe antihistamines, and they prescribe steroids even to these very small children of 1 or 2 years old. What happens is the 10 to 15 days they feel better. Again, after the effect of the dose, after the effect of treatment goes away, they get cough again. They become a chronic patient. They go to doctor every fortnightly. Once in 15 days, they get some form of antibiotic treatment, and due to that, they get side effects. So one patient has gone for one disease treatment, they become a permanent patient, they go again and again. So lots of Ayurveda practitioners here might have seen that the patient would have priced you by telling that after we came here, doctor, we never went back to allopathy. Now he is feeling lot better. Every December he used to have his wheezing increase. Now every December we need to go and admit him to the doctor. He will have fever. But now after the Ayurveda treatment, he is not feeling so. Every Ayurveda doctor, proper Ayurveda doctor, would have got this price at least one time in their life. So we do not work on the principle that the patient cured is patient lost. You can instead take this way. A patient cured goes and tells to 1,000 patients that this doctor is good, and they give you much more patients. We can only work based on this principle. So it is very important that at the end of the treatment, where Ruksha Guna is more, once when you remove the Kapha Varana and only Vata is there, in such condition you need to prescribe Chyawanprash, be it upper respiratory tract infection, or be it Kaphaja sinusitis where Kapha is involved, be it Kaphaja Kasa, anywhere after the Kapha has been removed away from the body, it is very important that you prescribe Chyawanprash. Or else, if the patient has continuous Kapha in the body, you can, at the end of the Rasayana therapy, at the end where you have to choose the Rasayana therapy, you can alternate it with Agastya Rasayanam. For example, for so many TB patients and so many asthma patients, we tell to take 1 spoon or 2 spoons of Chyawanprasha in the early morning and Agastya Rasayanam in the night. So, in such ways, the Chyawanprasha can be co-administered along with the other dravyas. So it is very important that at the end of the treatment, we need to choose this Chyawanprasha to increase the Roga Pratiroga Shakti of the patient. One of the things to be noticed while administering Chyawanprasha is that the Agni of the patient. See, when a Homakunda is formed, when a fire is created in a Homakunda, initially what they do, they collect the dry leaves and twigs and all together, and they create a fire initially, and after a small fire is created, then Grita is put on the top in a very less doses again and again. Then the fire gets more and more. So initially they don't use Grita to create fire, but once when a minimal fire is created, and after that the Grita is added to increase the fire. In a similar way, Chyawanprasha increases Agni, but it cannot give result in patients with extreme Ama and Prabhuta Mandagni. So in such conditions, in Mandagni conditions, you should use alternate Kalpanas which are extremely Deepana and Pachana in nature, Churnas and Kashayas which can cause Ama Pachana and Agni Deepana, and after that Chyawanprasha should be used. Sneha is Deepana in itself, but at least some amount of Agni should be there before itself, because there is a shloka called Snehameva Param Vidya Durbala Anala Deepanam Vyadi Muktasya Mandagno Sarpireva tu Deepanam. So here Chyawanprasha contains Tilatela and Sarpi. It is also a form of Sneha. Similarly, like administering Sarpi in the Homakunda, Grita, little by little, adding the Grita to the Homakunda increases fire. So similarly, in the patients, you can give Muhur dosage again and again, every 2 hourly or every 3 hourly, like 1/4 spoon of Chyawanprasha or Prasha quantity of Chyawanprasha every 2 hours once and 3 hours once. It gives excellent results, because when you administer them 2 spoons and 10 grams and something like that, they don't have better Agni which can digest the Chyawanprasha, because basically they don't have Agni. That is why the disease has come. So we should not create much more Mandagni to the patient. In such patients, you can always administer in Prasha quantity in Muhur dosage. Next point we are going to discuss is Chyawanprasha as the actual form of treatment, as the Vyadihara Rasayana in the body. See, in dry cough or in Vata Kasa and Vata Pitta Kasa, along with the other therapies, we can substitute Chyawanprasha, especially in the Muhur dosage. Like in Prasha quantities in Muhur dosage for dry cough gives very good results. to the patient. You can always administer it along with the other dravyas. For example, with Elakanadi Kashayam and Vai Guliga in dry cough, add Chyawanprasha, it gives very good results. So similarly, it is also very useful in Dushta Pratishaya, in Vataja Avastha of Dushta Pratishaya, because Dushta Pratishaya keeps on changing between Kapha and Vata Avastha. In Dushta, for example, the patient will tell the nasal obstruction this side, and after some time the nasal obstruction will shift on to other side, but rather the sneezing will not be there, or the cough, much of the kapha will not be there. So in such conditions, Chyawanprasha can be prescribed as a direct Vyadhihara Rasayana at the initial part of the treatment. In last video, people were asking about the best Chyawanprasha or the best company that we prefer. Of course, the company that we prefer is that we have got results only with the Imcorp's company. That is the best Chyawanprasha. I feel like in India, that is the best Chyawanprasha that is ever made, as far as I have seen. Imcorp's is a Tamil Nadu government owned company, and it's also AVP, Ayurveda Pharmacy's Chyawanprasha is one among the good Chyawanprasha that we can prescribe to the patient. And the best Chyawanprasha is that which we are going to prepare in our pharmacy next. Because when we prepare our own Chyawanprasha, the result is much more bigger. The result is so much different, and it takes effort to prepare. It takes long hours to prepare it, and a lot of procurement of drugs. But once we master prepare it, and our clinical results will be extremely different than what we predicted, because it is such a beautiful kalpana. I don't think we should leave it to any companies to let it prepared by them and given to us, because in order to reap the full benefits of this yoga, we need to make sure that everything is present in this yoga. So to end the video on the lighter vein, that I always feel the results of Chyawanprasha are underrated. No matter how much even the government of India has announced it, the Ayush has announced it, the protocol of treatment and prevention of COVID-19, I always feel the effect of Chyawanprasha is underrated, because Chyawanprasha has the drugs in it and has the effect that can give Lokakshema. Technically, it should be used worldwide for the betterment of the people. When you take Chyawanprasha, everything, you get rejuvenation, you get you move to an engage, your dhatus become good, you become more immune. So I don't know why such kalpana should not be used by entire world for the betterment of people. Because our guru runs an old age home. In the old age home, usually people there is a 50% people used to die every year because of some diseases. Because they are already in old age. So this year when COVID started in the March, we gave Chyawanprasha to a lot of old age people. This year surprisingly, so this is December, this year surprisingly the mortality rate is very very less. This year the mortality rate is only 20%, because everybody is taking Chyawanprasha now. So when we find such a result, when we find a drastic improvement or a drastic difference in the people who are taking Chyawanprasha, and it is highly underrated. Yes, it is used in India by most of the people, but still its effects should be much more global. We also do have a moral obligation, especially at this time when people fear for every disease that comes on their way. We have a moral obligation to explain the benefits of Chyawanprasha to the people around us, so that it will create a ripple of information, and hope it reaches worldwide. Thank you everyone.